पेशेंट के लिए भी, उनके अटेंडेंट्स के लिए भी। तो हमने पीछे एक मेकशिफ्ट हॉस्पिटल बना लिया, पर्दा लगा दिया, और पेरेंट्स से मैंने तुरंत पूछा। तो एक हमारा बंदा असेस कर रहा है, मैं उनसे हिस्ट्री ले रहा हूँ कि बताइए क्या हुआ, क्या हुआ, कैसे हुआ। तो दे ऑल्सो गॉट सम कॉन्फिडेंस दैट ओके यस वी शुड। अभी पहले तो वो रो रहे थे, बट नाउ दे आर टेलिंग अस द थिंग्स, दे आर लाइक ओके ओके देयर इज स्टिल होप।
Hi guys, a very warm welcome to all our listeners. I'm Dr. Sandeep, your surgery faculty. Today we have a very exciting news and an epitome of an event that I would like to share with you guys. I have Dr. Daman and Dr. Navdeep with me, and what they did is nothing short of a miracle that they pulled out recently. If you are updated with the news and all, on the 27th of this month, there was a flight that these guys have boarded from Delhi, Bangalore to Delhi. There's a Vistara flight, and whatever has happened on that flight, it's on a next level. I would want them to share their experience. I'll introduce Dr. Navdeep first, and then we have Dr. Daman thereafter. Hello, ma'am.
Hello. Myself, I am Dr. Navdeep, Senior Resident, Department of Anesthesia, Pain Medicine and Critical Care Medicine, and AIIMS New Delhi.
Great, ma'am. Great. Hi, sir. A small intro for our listeners.
Hi, very warm good evening to everybody. I am Dr. Damandeep Singh, Senior Resident, Department of Cardiovascular Radiology and Endovascular Interventions, AIIMS New Delhi. Hi to all.
Great, sir. Great. So, ma'am, can you walk us through what happened in that flight? I mean, I'm personally very excited after listening to news, and getting to listen from the horse's mouth is not on a daily basis. So, kaisa raha, kya tha, what is it? We would like to listen from you right away.
Okay. So, actually, we went to Bangalore for a medical conference. We were just boarding back to Delhi. So we were 5 of us, like including me, Dr. Damandeep, as he has already introduced. We had 3 more: Dr. Rishibjan from Cardiac Radiology, ILBS, and Dr. Oishika, Department of Gynecology, AIIMS New Delhi, Senior Resident, and Dr. Avichala, also from Department of Cardiac Radiology, AIIMS New Delhi. So we all were 5 of us were on board, and about half an hour after departure, we get an emergency call from the crew if any doctor is available. So all 5 of us, we see what is the situation, and then we see that there is just a small child who seems to be like totally cyanos, blue lips and blue tongue, blue everything. And the child was like non-responsive, and I could see that there is also a big scar on the chest.
Oh.
And I just saw that the child is totally non-responsive, and immediately we took it back at the plane. We kept the child on the floor, and we said that this is like a case of cardiac arrest, a very alarming and critical care kind of situation for us. Immediately, we started with our basic life support, as we all know how to start with. We started with chest compressions, and then we held the airway. For the airway, we need a device. So immediately, all the equipments were asked from the crew that whatever is available, you please bring to us so that can help us assisting with the resuscitation. So we see that I have a mask, face mask, but that is of like adult size. Now what to go up. In case of pediatrics, we are so specific with the size of the mask.
How old was the kid, ma'am?
Hanji?
How old was the kid?
The kid was just 1.5-year-old with weight of 6 kgs. And I had a face mask of an adult size. So, yeah, so still before that, I applied my 3 basic maneuvers for providing any kind of, adjusting the airway. That is head tilt, chin lift, jaw thrust. The 3 basic maneuvers. So I applied that and applied the adult mask. I started giving the breaths to the child via an ambu, but that was also of an adult size. So now comes the third point, circulation. I am giving breaths via an adult size ambu by holding an adult size mask, but by the 3 maneuvers. My fellow is giving chest compressions. But now what about circulation? For that, we need an IV cannulation. So one of the fellows looking, okay, what size of cannulas we have? Luckily, we had just one pediatric size cannula, the 24 gauge yellow size cannula we had. So just one cannula. Now we all know that it takes like so many cannulas. Sometimes we waste in getting one IV line, but like everything was falling in place, and we were successful in getting an IV access at the very first point. So that was the first point where we got some relief that at least we have an IV access, and now we can inject the drugs. So
Great.
one of our fellow, she started preparing adrenaline according to the doses of the pediatrics, and then adrenaline shots were given. The pulse were assessed intermittently according to the the BLS ACLS protocol at this time. But till 20 to 25 minutes, there was no pulse. The child was non-responsive. There was no pulse. After 20 to 25 minutes of our continuous CPR and intermittent positive pressure ventilation with boluses of ADR in between, I got a relief that yes, I can feel the carotid pulse.
Mm-hmm.
But that time we could see that yes, there is return of spontaneous circulation. Even the precordial pulse was also felt. We calculated the heart rate that was around 130 to 135 at that. So we got a bit relieved at that time, and we continued with our providing air, we say that airway positive pressure ventilation. So now after again like about 15 seconds, we again lost the pulse. So that was kind of again a very alarming situation that this is not manageable like this. We need to do something more extra. We immediately contacted the cabin captain that the situation is out of control. This child is already an operated case of a congenital heart disease, and that was very complex, which is known as TAPVC, total anomalous pulmonary venous congestion. And with basic just this much CPR, we cannot proceed like this for like 2 more hours, which are left to land to Delhi. We need an emergency landing, and which is the nearest possible airport. So Nagpur was advised, which was 15 minutes away. So we took the decision of landing at the Nagpur, but we made sure that we won't stop with our resuscitation. Till the time we don't have any monitor to assess what is the rhythm of the child, what is the saturation of the child, we will not stop our efforts. We continued with chest compressions, we continued with positive pressure ventilation, and at this point of time, that during that 15 minutes when we took a decision of landing to Nagpur, we received an AED also. The crew was very active in finding all the devices and getting to us. We got an AED, and I immediately applied the pads and on the suggested sites, and then it was shockable. So we gave shock also to the baby on the board. But still, what kind of alarming situation for us was that now I don't have anything to monitor. I don't know what is the effect of that shock, what is the heart rate of that child, what is the saturation of that child. Is it an improving trend or it is like deteriorating trend? Then we all were advised we have to get back on the seats for the time of landing. Now we cannot stay there at the back of the plane only, for resuscitating on the floor. We were all on the floor at that time. So, then the passengers were also very helpful. They vacated 3 long lane seat for us so that 2 of us, we can continue with our compressions by keeping the child on those seats. But now the situation was that for effective compressions also, we need a hard surface. We cannot even miss even 1 or 2 or 3 seconds of ineffective compressions. So at that time, we analyzed that, yes, we can use that big food tray that these crew members carry. The child is small, so we can keep that child on that food tray. And at least that can help us in providing that strong, heart base. Yeah, so 2 of us, we were on those seats. I was at airway giving positive pressure ventilation because I couldn't, and one was continuously giving compressions. So as soon as we landed at Nagpur, even the transfer till downstairs was also done on that tray only with continuous positive pressure and compressions. And as soon as we reached the ambulance, what we did was we just attached the monitors that I just want to see what is going on inside the body, the child. And I felt so much of relief that I could see the heart rate of around 142 to 145 at that time. and saturation was bit on the lower side, which was much expected that she
yeah.
was already a case of congenital heart disease, so it was around 51 to 52%. But at this point, we had a proper oxygen source, oxygen cylinder, the pipeline, and it was, positive pressure ventilation was given at this point with 100% oxygen, so saturation picked up, and finally, the child got back to life.
It's an amazing story, huh? I mean, you guys lived through it. I mean, the resources that you had, matlab, to be able to keep yourself calm in such rigorous environment, things are, aap bol rahe ho na ki it just fell as well. But putting cannula in a single go, that in a collapsed state, it does require a lot of skill to keep yourself calm as well.
Actually, sir, now if we go and think in the retrograde, retrospect manner, we think that the things were falling in place. Because I remember that there was a one time period was there on the board when we had an oxygen cylinder, but we didn't have a pipeline to connect to the AMBU.
Mm-hmm.
So, like, from where to get that pipeline? So for that emergency yellow mask, that they always show us that in case of decreased oxygen, you can get it. So there is a pipe, but that is attached to the bag.
Okay.
So at that time also, with the use of presence of mind, we used kind of one cutlery device available from the crew to just cut that pipe and then just use as a conduit between the oxygen cylinder and the AMBU to at least supply some of the oxygen, at least some extra oxygen apart from the room air. So,
I mean, you guys harnessed whatever you had, no? I mean, like, I don't know what to call the kids lucky or you guys are extremely skilled. But this is something, it's really inspiring. See, ma'am, thank you so much for sharing, the every single detail of what has happened. Small things, having that hardboard, that food tray used for compressions. And I'm sure you guys have at least been with that kid for 2.5 hours. Good, solid time.
Yes, sir. Like 1 hour was there on the boat of resuscitation, continuous resuscitation, and then 1 hour after landing till we, handed over the child to the pediatrician in a stable condition.
Ma'am, during when you were on board, no, jab aap kar rahe the, when you're doing, no, that's there's this point where you felt the pulse has gained back, fir laga ke ja raha hai. Did you even think for a minute ki probably will not be able to make this kid back? Laga ki shayad, the things are going bad or, it's not going the way we think it is. There's always this negative question.
There were many kinds. Right, sir. Yes, that's what actually many kind of thoughts were coming in mind. Agar nahi bacha paye to. But it was like we won't lose our efforts. We will not lose our determination till the time I cannot see anything with my eyes on the monitor that the child is not making up to it. We all will not lose the hope. Because without anything, without any monitoring, we cannot just lose our hope. We have to keep trying till we reach that time period where we can visibly see with our eyes.
Now, what you are defining right now, no, is the perspective of every young doctor. Those are going to listen to you. This is what we've been told, we've been trained. But putting that in light, ki last minute tak aapka, when you're saying it, no, ki we decided not to stop until we see it. It speaks volume of the effort that you have put. The mindset that you have. We being doctors, no, bahut baar ye hota hai, we try and till the end. Yes, kuch time we get the results on our favor kabhi nahi milta hai, but that point of trying till the end is something can't really define in words. Sir, I would like to take a bit of opinion from you as well, as you were also there. What was running through your head at that time?
So as she described a lot of incidents very vividly, and it is really this dramatic. I mean, I was thinking that whether is it all real? Because I'll be very honest, since I'm a radiologist and now I am doing cardiac radiology. So we have been very far from such scenes through our post-graduation and now also in the senior residency. So all this is not a very familiar thing to our side. So being a radiologist, we never see this mostly in our entire educational career. So this sort of event, that too in an unnatural setup.
It was
Even if such thing,
setup.
Even if such thing happens in front of me in a hospital bed or say an ICU, I may not know very ideally be knowing what to do. because honestly, we know that what are the guidelines, what is CPR, we know what is ideal chest compression, we know what is the rhythm, what is the rate. But yes, there is lack of practice, and the things are not on our fingertips. If such thing happens on a bus stand or say a railway station, one may use internet. Internet, everybody will become a doctor using internet. You will have a 10-second video on YouTube tutorial how to give a CPR. But this is happening over the clouds. So no internet support. Your only thing is your mind. So we were lucky enough, and we all were lucky enough to have a trained anesthesiologist and a trained obstetrician with us. Rest three were radiologists. So radiologists are in the supportive role. So
Well,
yes,
I'm sure no matter what, but you guys would have lived that moment. I mean, like, what ma'am was telling, no, sir, aap bata rahe ho ki, you have been out of touch of patients, being a radiologist. Sir, I see patients on a daily basis. Whatever ma'am was telling me, it was also, mere liye bhi, it was difficult to process because I have left seeing kids, pediatric cases chhode arsa ho gaya, sir, 10 saal ho gaye. And now suddenly ma'am was telling, 6 kilos baby, 1.5 year, all these, and then you have those cardiac anomalies, God knows what. But then
one thing was good that
crazy.
since now my profession is a cardiovascular radiologist, so I was very certain and sure that what is the diagnosis of the child, what surgery he has had. So he had a dextrocardia, he has situs inversus, he has TAPVC. So all these things were familiar to me because we are dealing with these patients every day. And I saw his operative notes. So I was confident where they have placed sutures, which site we should carefully avoid while giving the CPR. What should be, I saw his sternal wound, I know how much pressure to apply so it does not get dehiscent. So my added knowledge of cardiovascular anomalies helped me to think what is going on with the child. Why is he in this position? So that was there, and it was a collaborative team effort. So the team leader is leading the seat, rest are following, and everything is falling back in place. एक डॉक्टर थक जा रहे हैं तो दूसरा CPR दे रहा है, दूसरा थक गया तो तीसरा रेडी है. तो ये हमारे पास सिस्टम सेट हो गया था वहां पे.
So how was the parents' reaction, sir? Walk me through it. मतलब when you were, ma'am, you can take lead from here. As you were doing, जी sir.
I will share that हमारी सीट के कुछ सीट आगे ही वो फैमिली बैठी थी. And what was alarming thing, the first thing which was we noticed कि जो फादर थे वो बच्चे के ऊपर ऐसे they were putting wind, एक मैगजीन से he was putting wind. But I thought कि there is such a cool AC and I was feeling so cold. Why is he giving this extra air to the child? Then they both got panicked and they started crying that the baby is not moving. So, and the seat was right in the middle of the plane. So there was a panic. Now therein I stepped in and I said, let's take the parents and the baby away from people. First step for a doctor to perform his duty wisely is scene safety. उसके खुद के लिए भी, पेशेंट के लिए भी, उनके अटेंडेंट्स के लिए भी. तो हमने पीछे एक मेकशिफ्ट हॉस्पिटल बना लिया, पर्दा लगा दिया. और पेरेंट्स से मैंने तुरंत पूछा, तो एक हमारा बंदा असेस कर रहा है, मैं उनसे हिस्ट्री ले रहा हूँ कि बताइए क्या हुआ कैसे हुआ. तो दे आल्सो गॉट सम कॉन्फिडेंस दैट ओके यस वी शुड. अभी पहले तो वो रो रहे थे, बट नाउ दे आर टेलिंग अस द थिंग्स, दे आर लाइक ओके देयर इज स्टिल होप. So we kept the mother inside and we took the father into the along with people, and I asked all history and everything. So they were continuously praying. They were asking, "हमारे बच्चे को बचा लो." So we were aware of the risks. I got immediately aware that it is a very high risk case. The bacha has got surgery, and there are a lot of anastomosis. There are a lot of complications, and they are known to happen even in a normal situation. This is a high altitude state. So the pressures are low, the saturations are different. How this child will react to this is very different as compared to एक नॉर्मल बंदा जैसे उसको रिएक्ट करेगा. तो पेरेंट्स बहुत शॉक थे, बहुत सब थैंकफुल, वो बीच में थैंकफुल भी थे कि इतने सारे डॉक्टर बच्चे को देख रहे हैं. तो उन्होंने भी अपना पूरा काम कंपोज स्टेट बना के रखा. और शायद मैं ये समझता हूँ कि अच्छे डॉक्टर को पेरेंट्स को समझाना भी बहुत जरूरी है. पेरेंट्स ही नहीं, किसी भी अटेंडेंट को. सर जैसे आप सर्जन है एंड यू आर ऑन्को सर्जन, so that is a branch which involves so much emotion.
You took away that nervousness from the air. तो उनको ना the minute parents would have felt कि हाँ that safe hand is there, they would have got that, the strength to at least think about something positive.
We are dealing with ultrasounds and CTMR, so nothing was there.
No, but to keep calm in that, environment and reassuring the parents, not over assuring it, and, keeping those protocols, ki har ek choti baat ka, that's very important for listeners who are actually listening to you right now to understand. Even in the, the most dreadiest of situations, you should fall back to basics. You should remember your protocols, communicate, don't over assure, and do the best you can. I mean, like, with the small talk, sir, I mean, I feel, it's an inspiration to an entire set of generation of doctors who are just listening to us. Once you landed, then how was the kid, sir? Was he doing better? Okay. Was he shifted back to hospital? Once you landed in Nagpur, was the kid shifted back to hospital? Were you there until the kid was shifted, or did you stabilize, as ma'am was saying, कि ambulance तक you guys were there?
फ्लाइट क्रू को इन्फॉर्म किया था कि आप नागपुर अथॉरिटीज को बोल दीजिए कि बच्चा है और सांस की पाइप की जरूरत पड़ेगी, क्योंकि हमारे पास फ्लाइट में लिमिटेड जो चीजें थी उससे हमने उसको सस्टेन किया, पर उसको एक डेफिनेट इंटुबेशन चाहिए थी। तो 3 या 3.5 की जो ईटी ट्यूब चाहिए थी वो नहीं थी, तो हमने उनको कन्वे किया ये 2 चीजें हमें चाहिए, बाकी सब है। तो उन्होंने कॉल की, तो व्हेन द मोमेंट वी लैंडेड देयर वाज एन एम्बुलेंस with a EMT, so there was a emergency medical team there. तो उसमें currently वहाँ पे तो then we landed, we shifted the child to the ambulance. तो added advantage था कि अब हम उसका ECG देख पा रहे हैं, saturation दिख रहा है उसका हमें, तो अपना response भी हम देख पा रहे हैं कि now we can titrate our treatment according to the parameters. पहली advantage हमें ये हुई, पर अभी भी the pediatrician was on the way. There was lot of security checks which he had to clear in order to come in with a full blown ambulance. अब laryngoscope एक metallic instrument है, all these instruments there was a bit of lag, but उस समय तक जहाज रुका रहा, हम नीचे उतर गए और हम बच्चे के साथ एम्बुलेंस में खड़े थे. Parents were by our side. The moment the pediatrician arrived, the pediatrician and Dr. Navdeep, they both discussed. अब वो सबसे important point था that she told him the over. जैसे हम ड्यूटी के एंड में ओवर देते हैं, यार इसको 4 सलाइन दे दिए, ये दे दिए, अब उसको बताना भी है ना कि इसको ये दिया है,
जी जी,
अवॉइड एनी टॉक्सिसिटी, टू अवॉइड एनी ओवरडोज, तो उसको 1 मिनट में बता दिया इसको इतना एड्रेनलिन इतना ये दिया है, तो वो काम भी हमने किया। और उस बंदे ने देन he intubated the child. He was a pediatrician, he was carrying everything, he performed his job, he intubated, and then then everything was sorted. So parameters are okay, and for our documentation also that we have handed over. एक डॉक्टर के लिए अब मॉडर्न प्रैक्टिस में he should always document.
True sir, absolutely.
आपने पेशेंट को देखा है, आप वर्बली बोल दोगे देयर इज नोबडी इज नॉट एग्री, आप डॉक्यूमेंट कीजिए, पैरामीटर्स नोट कीजिए, इट रिफ्लेक्ट्स यू, आपको हमेशा प्रिपेयर्ड रहना है, आपकी हैंडलिंग नोट्स और आपके पैरामीटर्स। तो हमने उसका वेंटिलेटर सारे पैरामीटर नोट करके एंड वी पुट अ नोट, और ये हमने नोट एयरलाइन में भी डाला कि ये सिचुएशन थी, इतनी दवाई दी गई, ये किया गया। तो बच्चा वहां से चला गया उनके हॉस्पिटल में। अनफॉर्चुनेटली हमारी जो फ्लाइट थी इट हैड टू कम बैक, लॉट्स ऑफ पैसेंजर हैड अ कनेक्टिंग फ्लाइट। एक्चुअली भी हमने सच में सोचा कि हम इसको जाके वहां तक स्टेबलाइज करके आए, बट द सिचुएशन वाज सच, इट वाज लेट इन नाइट, इट वाज 12 AM and it was still 2.5 hours to go to Delhi. तो और सुबह ड्यूटी भी जाना था। So since we are residents, अब residents को punctual रहना है अपनी ड्यूटी पे।
Absolutely sir.
तो हम then we had to come back. We trusted the pediatrician and we trusted the doctor fraternity.
You guys have done beyond sir. मतलब can't expect more. I know I've been taking a lot of time. Ma'am, quickly, I just want to draw inspiration for a lot of young crowd who's listening to you. If you have to summarize this one journey, I know you wouldn't forget this for life, the events like these are not common. So agar you had to, summarize this into one particular an inspiring story, or a message that you would like to give it to our listeners, I'm sure every doctor around India would actually listen to this. So the stage is yours. I just want you to inspire a whole set of people.
Actually, we often read that in any kind of crisis situation, we need to stay calm. Stay calm is foremost thing. Then only you'll be able to apply the gained knowledge and experiences that you have had till date. So like we do always read about, crisis management, emergency situation. So it was like kind of first in a lifetime kind of practical situation for us, all of us. So I think staying calm and remembering all my knowledge and experience as well as of all the others and the inputs given by all the others and consolidating that into a common solution helped us in getting a positive effective solution to the this entire scenario. So staying calm and having faith on yourself and staying determined even in harsh of the situation is very important, and not losing hope.
Thank you, ma'am. I mean, like, great advice. Every word matters. Sir, would you like to address all the radiologists out there, the inner doctors in them? Let's hear it from you, sir.
So my message goes for every doctor, no matter he's a radiologist, no matter he's a pathologist, no matter he's in biochemistry. So these days, the doctors, when they choose a post-graduation branch, they get just psychologically disconnected. But they all forget that we all are having one common thing. A CTV surgeon, a radiologist, a pathologist, they all have one common thing. They all are MBBS. So when the backbone is same, you are all same. You are the branches of a same tree. So one does not have to forget the main principle of being a doctor. It is to heal and do no harm. तो ऐसा सिचुएशन कभी भी अगर किसी डॉक्टर की लाइफ में राइज होता है, he should not worry, he should be confident, वो he should make himself competent. How he can make himself competent? See, nothing can replace reading, nothing can replace knowledge. I believe every doctor in India should be competent enough to perform a basic life support and also get a certification for ACLS, Advanced Cardiac Life Support. These two things are mandatory for every resident or every doctor in India. But yes, we all agree that it just slips out of the mind. So maybe this incident can be a pivotal incident. And और कुछ नहीं तो सभी एक बात उस गाइडलाइन का PDF अपने फोन में सेव कर लें, so that even if they are on board a flight or any situation where they're unable to remember, unable to access the internet, they should have it in their phone. तो खोलो, रेफर करो, इलाज चालू करो.
Great advice, sir. Great. Again, emphasizing on basics, I've never gone out. So I'll just take this opportunity to conclude, and I've taken so much amount of time. I know both of you are extremely busy. Thank you so much for taking your time out, getting all this out in front of people who matters. And every single word that you said, I know every guy who's listening to this particular video, it's gonna get inspired. Like it's nice. It's never like before, but the whole objective of being a doctor is just justified by this one small event. The event is small, but the impact is huge, and extremely huge. So thank you, ma'am. Thank you, sir, for having so much amount of time. So all the guys, keep doing what you're doing, right? So get to the basics. Thank you. Asif, roll out. Thank you, ma'am.